my people were suffering. We were drinking water down the river, drinking that water. People were suffering seriously. The main objective of this project is to improve on the situation of the refugees in the settlement in terms of water supplies and services. In April 2020, the project received a supplementary funding from Swiss Red Cross with the main objectives of improving access to safe water.
At first, we are getting difficulties in water. We used to drink water from river, and that water was not okay. Now, the Red Cross, with the support of the Red Cross, they bring for us water. Now I'm able to get clean water. I can even drink clean water. I use clean water for washing, for bathing. Now I'm feeling okay. I'm very happy with the support of the Red Cross. Services have come very nearer to the community. We have no more challenge about water. I'm quite sure if this start working, my people will be very happy, in fact, for Red Cross for bringing this water source very near to us. Secondly, we have young kids, pregnant women who are supposed to move some long distance to look for water up the riverside. But now, due to Red Cross extending this pipe water nearer to the community, I hope to see there will be no more problem.
This particular funding that we have from Swiss Red Cross has a far-reaching impact in the communities, as it has been already mentioned that the needs of water supply in the particularly in a Zone 3 Paleronia settlement, and also the needs of menstruation hygiene management, and especially the time when this funding arrived, it was last year COVID-19.
This supplementary funding has enabled us to procure 1,458 menstrual hygiene management kits. 1,410 of these kits were distributed to young adolescent needy girls in 7 schools of Zone 3, east and west of Paleronia refugee settlement, to support them improve the management of their hygiene during menstrual periods.
Previously, we have been facing a lot of problems affecting these learners. In most cases, we realized these learners, their attendance were very poor. They could not come to school every day whenever they are in their period. So they sometimes absent themselves for 4 to 5 days without coming to school. Simply because when they come to school, they are always feeling moody because there was no care given to them. And secondly, you realize that majority of them, whenever they are in that period, when they had a mistake, boys laugh at them, and at the end of the day, they get disappointed and go home. So I want to take this opportunity to thank Swiss Red Cross and the Uganda Red Cross for the tireless effort of distributing menstrual hygiene kits to these learners. There were buckets distributed to these learners, and inside the buckets, there were a lot of good things that these girls enjoyed.
When we arrived here, life is hard. We could not get menstrual hygiene kit, and to buy pads, it is by then expensive. Where other students who are not strong, they have dropped out of school. But when we have received those menstrual hygiene kit, we find that it helps us better in the school. And even me myself, when I'm in period, I usually put on them, and I really feel comfortable when I'm in class.
The SRC support enabled us procure 37 sanitation toolkits. These were distributed to 370 households in Zone 3 West of Paleronia refugee settlement to support them construct and use adequate but also decent sanitation and other hygiene facilities in their respective households.
I thank Red Cross for the intervention that it has improved the health of the refugees and the host community.
And then lastly, I would say that, of course, we have a very huge needs still on ground in terms of operation and the maintenance of the different water supply systems we have, along with the menstruation hygiene management. So we would definitely appreciate, and we will continue to highlight the vulnerabilities and the needs on ground, especially in the West Nile, and I mean generally in the West Nile and particularly in the Palaronia refugee settlement. So we will continue to highlight these gaps with our donors and especially with the like-minded national societies to ensure their support to the refugee response in Uganda.